with another pregnancy update, and this pregnancy update will be covering weeks 28 through 30. So we are officially on our countdown for when the triplets will arrive, and I am so excited, but also nervous and trying to get everything ready for the triplets' arrival. So we're only about 6 weeks away from our big goal of delivering at 36 weeks, which will take us to May the 21st. I am excited, not quite ready. I want them to stay in a little bit longer. I still have some preparations to get done in the house and also preparing my family for the triplets arrival. So not quite ready for them to come yet, but I am so excited that we are officially counting down. I don't have that much time to get ready, so I need to hurry up. At 28 weeks, we had our last ultrasound, and the babies are growing so well, which makes me really happy as a mom, of course. They're all measuring above the singleton scale as far as weight, and all of the measurements that they take and look at, everything is looking really good. All of their organs and their head circumference, all of that combined, they are measuring above the singleton scale. So that makes me really happy, especially since I haven't had much of an appetite, and you guys know that I have really been trying to grow these babies as big as possible without the appetite being there, and just kind of force feeding and eating high calorie meals. So baby A was weighing in at 2 pounds and 14 ounces, and baby B was weighing in at 2 pounds and 10 ounces, and baby C, which is my boy, he's the smallest at 2 pounds and 9 ounces. But they don't have any worries whatsoever since they are in a higher percentile on the growth chart. Baby A's position was, she was breech, and baby B was head down, and baby C was transverse. So they're all kind of moving in this circle, which is okay, but I would really like for them to start being head down. As far as my weight, I am currently 199 pounds. And I've gained 42 pounds so far. I'm also getting like the nice round fluffy pregnancy face, and my body is just filling out a lot more with the triplets, which I'm really excited about. It is recommended that I gain 2 pounds a week, and I am a little bit under that. But the babies are getting bigger, so no worries over here. I would just like to put on a little bit more weight, and I've been sitting at 199 for about 3-ish weeks now. So hopefully my weight will go up, but the babies are weighing really well, and I guess that is what matters in this situation, is that the babies are growing, and maybe they're just taking a lot from me. I am drinking over a gallon of water a day and not quite meeting my calorie intake of 3,500, but I have good days and I have bad days when my stomach is just feels so shrunk, and it's not allowing me to get much down. So I eat really small meals, but I try to make sure that I'm packing in those calories during those meals. So making everything really intentional is key, and at this point, especially since we don't have much longer, I want to get them to start growing as big as possible. My doctor did tell me that in the 3rd trimester, which I'm so happy to be at, the 3rd trimester, in the 3rd trimester, triplets start to slow down in their weight gain, but we'll see. So far, the triplets have been growing pretty well, and we'll see at our 32-week appointment whether or not they're slowing down in their weight gain. Also, lately I have been craving ice. It has to be pebbled ice, and that's my craving right now. Like, I crave it like a fiend. I have to have at least a big, huge cup a day, and I have a specific order. It is fill the cup up with ice and then put the water in, because I want more ice than I want water. So that's one of my biggest cravings right now. As far as me personally, it's getting a little hard to carry the triplets. They are getting very, very, very heavy. I am very thankful, however, that I'm not in any type of excruciating pain, but just imagine trying to roll over in the bed. It is not fun trying to roll over in the bed, switching positions, especially since I have to sleep on my side. One side always gets more tense and more pressure than the other side, so I roll over, and then using the bathroom about 4 times a night, waking up to use the bathroom about 4 times a night, especially since I'm drinking so much water during the day. That's part of me just listening to my body. My body is asking for water all throughout the day. If I don't drink the water, I feel very, very, very dehydrated. Or even if I get in like 2 liters of water, I feel completely dehydrated and my mouth feels very, very, very dry. The babies have moved up. It's harder to breathe, and they are smushing my stomach as well as my lungs. The babies have hit a growth spurt recently, and when they do hit a growth spurt, I can feel it. My stomach starts to stretch so bad, and it becomes very, very, very sensitive to the touch. I don't have any pains, like excruciating hip pains. The only back pain that I have is not really a pain, but if you were to go to the gym and you're working out your back, that's what it feels like if I'm bending over too much during the day. It just feels like a whole lot of tension and a whole lot of pressure on my back, but I'm not having any back pains, and I hope it stays that way until we deliver the baby. I recently told my doctor about some cervix discomfort that I was experiencing one day. I think I just was walking around too much during the day. My cervix on the right side, I could feel a lot of discomfort. She told me that, you know, my body is pretty much getting ready for the babies to come, but I'm like, okay, my cervix do not need to be trying to feel any type of discomfort. So once I started feeling the discomfort in my cervix, I did lay down for about 3 consecutive days. I took that time to just put myself on a bed rest, and that's all a part of listening to my body, knowing what my body needs, and making sure that I'm doing my part to be sure that we keep the babies in as long as possible. About on the 4th day after laying down so much, the cervix discomfort did go away. I also did tell her about some contractions that I was having, and I thought that they were longer than a normal Braxton Hicks contraction. She advised me to start counting my contractions to see exactly how long they are. Now, I did tell her that the contractions were lasting 40 seconds. However, once I got home and I started to actually monitor the contractions through a contraction app, they were a minute and around 30 seconds long. So some were just under a minute and 30 seconds, and some were just over a minute and 30 seconds long, which really surprised me because that is a long time to have a Braxton Hicks contraction. During my singleton pregnancies, the contractions were lasting about a minute all the way up until I pushed, maybe a little bit over a minute. So for my Braxton Hicks contractions to measure about that length, like shows me that this uterus is huge, okay? It is huge. Labor contractions are probably going to be 2 to 3 minutes in length. So she warned me, do not compare my contractions to my singleton labors. If I start to have contractions that last 1 to 2 minutes and they're coming every 10 minutes, that I need to call her and try to come in, because then we will be able to see if they're making any changes to my cervix. So we're not playing around with these contractions, and I have been trying to count them and keep up with them using a contraction timer app, which has been so helpful. I've always used a contraction timer app in all of my labors to be sure that I was actually in labor and to kind of monitor exactly how my labor was progressing. However, this time I will not be laboring at home. With my singletons, I stayed home for hours before I went into the hospital. I wanted to be comfortable in my house laboring as I pleased. And then whenever I felt the need to go to the hospital, I just went to the hospital and labored as I pleased there. Which takes me into my birth plan. Okay, so if you guys don't know, I do see 2 different doctors. I have an MFM doctor, and I also have an OB doctor who will deliver me. My MFM doctor is a maternal fetal medicine doctor, and they specialize in the overall well-being of the triplets. In my last pregnancy update, I did mention that we will be going for a vaginal birth as plan A, and then if any complications arise, we will be having a cesarean section with the triplets. That is still in place as of right now. The only thing that is kind of hindering us and that we need to pay attention to is turning the babies. Having baby A in a very optimal birthing position will set us up for a successful vaginal delivery. My OB doctor is 100% for going forward with a vaginal delivery, and she looked at me and said, okay, it's up to your babies at this point, and you try to get the babies turned. So Anthony and I have been trying to get the babies turned through spinning babies. I've been trying the forward leaning inversion position where I get upside down, and just to give my uterus a little bit more stretch and to hopefully let the babies know that they have a little bit more room to move around. Sometimes our uterus and our ligaments can get tight or used to being in the same position. So being in that forward inversion position helps my ligaments stretch a little bit. I think baby A is really enjoying being in a transverse position as well as breech. She's probably flipping between transverse and breech, where we would like her to be in a head down position. That is the optimal position to have a vaginal birth, even if B and C decide to be breech. Having baby A head down would be like a check for us as far as our birth plan is concerned, and so much easier with us going forward with our vaginal delivery. Another point that I wanted to make about my doctors is my MFM doctor is not in favor whatsoever with delivering the babies vaginally. While, of course, my OB doctor is 100% in favor of going forward with the vaginal delivery as long as complications do not arise. This is where I have a problem with my MFM doctor, and I'm not being pushy towards him or them because it's more than one, but their reasoning for having a cesarean section as plan A is not a reason that I could see why I would need to have a cesarean section as plan A. They pretty much put me in this routine type of deal, like this is what we do. We deliver triplet mothers at 35 weeks. I have a lot of issues with that type of approach because a cesarean birth is a major surgery. Hemorrhaging during cesarean birth is a lot more common in a cesarean birth than it is a vaginal birth. So just to take all the factors into consideration, a vaginal birth is more desired for me, for my case, because I don't have any complications as of yet, and I hope that we never do have any type of complications. But having a vaginal birth is my desire for a lot of specific reasons, all evolving around the fact that a cesarean birth is a major surgery. My whole desire is to go into spontaneous labor with the triplets at 36 weeks. And my doctor, she's all for it as long as the babies are doing really, really well. They start their testing at 32 weeks where we make sure that they are moving well, they're breathing well, they are doing everything that they're supposed to be doing in utero, and that's called a biophysical profile. It is very similar to a non-stress test. All in all, to carry them to a longer gestation is my goal, because that means a possibly less NICU time for the babies. And even no NICU time if they come out and they're really, really healthy. And that is our goal. Our goal is to have 0 NICU time and to have take-home triplets. That is my heart's desire. I will be so heartbroken if I have to leave the babies in the NICU, but I would want them to be in a healthy state before they come home. One of the big views that the MFM described to me is that having the babies being born at 35 weeks is safe because their perinatal care has increased in operation, and over the years there is nothing like a baby staying in utero until it is born. That is the safest, wholesome place for a baby to grow instead of an incubator outside of the mother's womb for no reason at all. So my problem with the MFM doctor is that I don't have any complications, so let's not schedule something that has not occurred or will possibly not occur. That is where we are as far as my birth plan. Another topic that I discussed with my OB doctor is where we will labor and deliver. I figured that if we go into spontaneous labor, I will transfer to the hospital. We will labor all the way up into the point that I get an epidural. While we have the epidural, as my cervix starts to change and it's close to time for the baby to come, that we will deliver in the operating room. My OB doctor told me that she would prefer to deliver in the labor and delivery room because in the case that one of the babies get distressed or we need to get the babies out as soon as possible, she feels a lot more comfortable with getting the babies out vaginally than to have to do a cesarean section. Now, there are possibilities where we will need to have a cesarean section, but those are the most extreme cases. If we have to transfer to the operating room, then we will make that transfer. But her comfort level is to deliver within a labor and delivery room. Also, another thing about my OB delivering doctor is that she is experienced with delivering multiples. She has had multiples herself, and she has delivered triplets vaginally. That was number one on my list. I was not willing to negotiate or try to push power on any type of doctor that did not have the experience and the comfort level to deliver the babies vaginally. That's just something that I was not going to push. I'm not willing to push at all whatsoever. And I just lucked up to have a doctor that was willing, and she's able to do it, and she's really encouraging me. We just have to get the baby's turn. So now let's measure these babies and the circumference of my bump. The last pregnancy update that I did, I believe we were at 49 inches. And I'm excited to see where we are now. Okay, here we are. Here are the babies. I hope you can see them. They are getting so big. And let's see. I think we can see like a little limb or something just sticking out right there. I don't know if you guys can see it or not, but that is a baby poking out. And they are asleep right now because I cannot feel them. Okay, and we are going to measure this bump and see where we are. Okay, I think we are right at 51 inches. 51 inches in circumference at my belly button. We're measured. And I'm so happy. That is 2 inches larger than where we were at our last pregnancy update. 51 inches. As you can see, I am in our unfinished nursery, so I have a lot of work to do before the triplets come. Thank you guys for watching. That is our pregnancy update and birth plan. Up until this point, hopefully we make it long enough to do another pregnancy update, possibly within 2 weeks, around 33 weeks. I'm thinking would be really good to see how the babies are growing and update you guys on their biophysical profile tests. Don't forget to like and subscribe to our channel if you are new here, and turn on your post notifications so that you don't miss an update from us, because we will hopefully have a birth vlog for when the triplets do arrive. So don't want you guys to miss that. Hit the bell, and thanks again for watching. Bye.